beginning, we were using hydroxychloroquine. It was effective against the first SARS, it was effective against the second SARS. It made sense to use it for the third one. So we used that for a period of time, using it early, using it low dose, not high dose, and we saw people with this combination getting better. When it became increasingly difficult to get hydroxychloroquine because your big name pharmacies refused to fill it for COVID, then we switched to ivermectin. And ivermectin I was using prior to COVID for irregular cytokine response with regards to autoimmune disease, and I saw clinically testing cytokines before and after, saw great results. So it made sense to me to use ivermectin for managing the cytokine response. And then it became increasingly more difficult to get ivermectin because, again, the big name pharmacies were refusing to fill it because it's an off-label use of a medication for COVID. But the reality is we've been using medications for years, off-label use for different conditions. Like, this is a known practice. There's an approved condition for a particular medication, and yes, it will be prescribed for that. But then there's off-label use of certain medications because we know clinically it works. So you haven't had a pharmacy refuse to fill a prescription for a safe medication ever before. You haven't had this, where they refuse to fill a medication that's safe, and you're doing it at doses that are safe, proven to be safe. You haven't seen it. You haven't seen them refuse to do this before. But all of a sudden, the pharmacies refuse to fill prescriptions for COVID when it's off-label use. There's something else going on, and you can read between the lines. So then we have having people take zinc as far as its antiviral property. We have people taking selenium for the immune system. Have people taking aspirin to prevent blood clots. Have some people taking nattokinase to prevent the blood clots. It's been, and then we've had to do IV hydration for some people. We've done the monoclonal antibody treatment for some people, and I've had to do a IV antibiotic for some people when they weren't able to tolerate the oral antibiotic, or it got to the point where it was that severe, and we've had to do home oxygen for a number of people. But thank God, like I said, treated around 1,500 patients, and everybody is alive, and thank God, doing well. In terms of long COVID, is not a mystery. Reading up on my grandfather's papers about post-viral neuritis, that's essentially what a lot of post-COVID is, long COVID is, where there's a neurological inflammation stemming from post-viral infection. We know this happens with shingles, for example. One of the best ways, is when you do a steroid during the actual infection, that reduces the inflammation and many times prevents post-viral neuritis. There's also pulmonary inflammation, residual pulmonary inflammation from the infection that seems to hang on as well. So what I've seen with at least 100 patients is using neural support that we make with referral medicinals to reduce the neurological inflammation, treating the brain fog, the fatigue, issues with word recall, and that has worked beautifully. Also, respiratory relief tea for hydration, drinking it 3 times a day. It's worked beautifully. We have had to do hyperbaric oxygen therapy for some people, but few in terms of that haven't seen results from neural support and respiratory relief. So there's many issues that have come up with COVID that have made most people more skeptical of the medical profession, our healthcare system, and rightfully right, they should be. But the reality is there are doctors out there that care about people and are really trying to do the right thing, and God willing, more the medical profession will catch on and come back to having the patient being the focus and doing what's right to help people and to help society in general. So God willing, only good health and good news for everyone.